When it comes to optimizing your body for fertility and conception, there's a couple essential ways that you can do this to help prepare your pelvic floor and make sure that your organs are moving so that every single month ovulation can happen, the ovary can release an egg, and then it can shimmy its way down the fallopian tube and then meet up with the sperm, and then there you hopefully you get a fertilized egg and then implantation. So what do we do to truly help facilitate this process? Well, we do a combination of things. First off, pelvic floor physical therapy is going to be absolutely essential in how we open up the pelvic floor. Here's a picture of the pelvic floor, and the organs sit right above the pelvic floor in a bowl. When we have dynamic motion of the pelvic floor, when the pelvic floor can open really easily, it's going to have more blood flow, and therefore the organs are going to have more blood flow. A lot of times what we see is that people have tightened, more contracted pelvic floors, and therefore is a little bit more dehydrated, and there's less movement. Number one, that can make intercourse a little bit more uncomfortable. And number two, it can just it can restrict the organs from truly moving freely within the actual pelvic bowl. And so how do we get the organs to move freely? We use a technique called visceral manipulation. We help the organs move inside the body. All organs, whether you are breathing or not, need to move. They ebb and flow towards midline. So they move away from your body and then they come in towards the midline of your body. The organs have to do this. Now, if we have a lot of tension in our abdominals and in our pelvic floor from chronic stress, previous surgeries or scar tissues, previous pregnancies, or previous inflammation, constipation, diarrhea, pelvic pain, other issues, you can get tension that causes restriction and limits the visceral motility. So using techniques like pelvic floor physical therapy, we have generated these fertility protocols to help facilitate fertilization and really improving the fertility process. And our clients have, when they add this to whatever they're doing, whether it's natural conception or they're going through IUI or IVF, when they add in pelvic floor physical therapy, they are much more primed for that conception. Now, once we started using radial pressure shockwave on the lower abdomen to help improve the endopelvic fascial mobility and to improve the mobility of the actual organs themselves. So improving our visceral manipulations techniques to enhance how much those organs can actually move in our body. So how much the fallopian tubes can wiggle the egg down, how the health of that ovary can release an egg. When we use radial pressure shockwave, what it is doing is it's pulsing these sound waves into the tissue, which is creating a little bit of micro trauma. But what it does is it creates angiogenesis. So it lays down new blood vessels, new vascularity to these organs. When these organs have more blood flow, they are healthier organs and they move more. Now, are we getting as deep into the pelvis, directly to these organs? No, but what we notice is that we have way more pregnancies once we add in radial pressure shockwave to all of our fertility protocols. It is an absolute essential because what it's doing is it's helping maintain that visceral motility. So how much those organs are moving and then therefore how well they're functioning. Positive side notes of this is you get lower abdominal strength a little bit better because you're doing it over the transverse abdominis muscle, which creates more tension in that transverse abdominis muscle, which is going to set you up really nicely for your pregnancy because that's the muscle you want to keep strong. And also it's creating a lot more mobility in the uterus itself. So our clients end up not having any menstrual cramps. So if they had menstrual cramps, heaviness or achiness, or even low back pain during menstruation, all of a sudden they are noticing that they are completely pain-free during their menstrual cycles. And so if we can get someone pain-free during their menstrual cycles, not only is that a positive, but we're also priming them and setting them up for the conception itself. Now, a ton of other things go into fertility. Can some people have diagnoses and other issues creating blockages or creating problems, including the man can also have problems? Absolutely. This is just a way to help optimize our bodies for our menstrual cycle and for conception. So the healthier we can get our organs, the more we can get movement, the healthier and stronger we can get our core, the better things are going to be in general. Not to forget that if you have constipation and or bloating, the shockwave is absolutely amazing at helping you get more visceral motility, helping you create more peristalsis, and therefore get more poop through your system. So I'm Dr. Allison Feldt. I hope this clears it up. This is absolutely amazing when we use radial pressure shockwave in conjunction with our pelvic floor protocols in order to help facilitate pregnancies, and our results are honestly undeniable. We're working to collect more data so we can publish the results, and of course teach more practitioners, because this is absolutely amazing if we can find a way to help moms that are struggling and or just want to prepare their bodies for that conception that itself. Another important thing that we use in the clinic is called EMTT. And so EMTT is an electromagnetic transduction. It's a high frequency magnet that helps pulse out inflammation away from the organs. So organs and the viscera and the gut can have inflammation in it, which can restrict the function of the organs themselves. So using this high frequency magnet helps pulse out that inflammation, allowing the bad stuff to leave the cells and the good stuff to enter the cells. Therefore, we're just going to have a healthier system in general and really be primed for conception. A few notes is that we start the radial pressure shockwave during day 1 of your menstrual cycle, and we go until you have ovulation. So we do suggest that you track your menstrual cycles. We have different blogs and resources about how to track your menstrual cycles, whether you decide to use an app or you're just going based on basal temperature, or there's a million ways to do it. There's also devices that you can pee on a stick every single day of the month and just track your ovulation that way. So I hope you found this information valuable. I'm really excited to be a part of your pregnancy journey and improving your chances at the fertility and pregnancy of your dreams. Of course, all the work that you do during fertility is only going to improve the amount of preparedness that you are for the actual birth when it comes due. So I hope you enjoy this message. Please leave comments below. I'm happy to answer any questions or anything that comes up that I maybe didn't cover or I skimped over.